Well, good afternoon, and again, welcome to our lunch tables on this rainy Wednesday here in Northwest Indiana. We are super excited to have our presentation today on One Pill Can Kill. So we are going to have our special agent, our guest speaker, take over the floor here in just a moment. But a couple of things real quickly, housekeeping. I am your host today, Jason Kegabine. Donna sends her greetings, our executive director. She's not able to be on today entirely, so I am tag teaming with her. So a couple other quick housekeeping items is that we want to make sure that your names are displayed. So please go ahead and fix those there so that if you have a question or if there is something in the recording that you would like to get back, we can send that to you. Please make sure that you're muted. Again, I know that we are still in this whole Zoom kind of world, but just in case, you've got Amazon packages coming and dogs barking and all that good stuff in the back. We want to be respectful to our speaker and those that are here listening today. Also, if you have any questions, please go ahead and put those in the chat or go ahead and raise your hand with one of the icons and we can acknowledge you throughout the presentation, or we can even wait to the end of the presentation so that we can get those answered for you. So our presentation will last anywhere between 45 minutes to 50 minutes long. And then from there, we'll have a couple-minute break and break out to our small groups there. And then we'll come back for some Q&A. So pretty standard and pretty much the same format that has been going on since we've started with our lunch table. So again, we appreciate that you are here today. Great information, great opportunities to connect and to learn with each other and to network. So without any further ado, I'm going to go ahead and introduce our special guest speaker today. And he's got a quite intensive biography here. So that's all for you guys available too. I'm just going to kind of highlight a couple of things here. But of course, I'll let him introduce himself as well and to share some of those great things that he's done in his career. So again, we appreciate you being here. So without further ado, please welcome our speaker today, Special Agent Greg Chakowski. Hopefully I pronounced that right, but if not, I apologize.
Well,
he's been with the Drug Enforcement Administration for 18 years. His career began in New York with the NYD division, where he has worked intensely to disrupt and dismantle various types of local and international priority target organizations, also known as the PTO. During his career, he has developed, controlled, and debriefed confidential sources, coordinated surveillance operations, as well as directed undercover operations. He's responsible for cases that led to several arrests and seizures of narcotics, firearms, vehicles, and money. He has testified as a witness in the federal trials and federal grand juries and has been the undercover in several buys and bust operations, and that just continues to go on and on and on. Great biography, great presenter today, so we're looking forward to that. So again, his full biography will be available to you on our website, as well as all the literature that we've sent out through our e-blast. But again, without any further ado, I really wanted to turn this over to him. I'm excited for today's presentation, so thank you for being here today, Special Agent, and the floor is now all yours.
Thank you very much. I appreciate it, Jay. Again, I apologize for some of the technical difficulties that were going on earlier, but obviously we worked out those bugs. With respect to bios, I mean, honestly, when you're getting a presentation or you're being instructed by someone, it's always nice to know, well, what's their background? What's their, where do they get their knowledge and experience from, basically? So it's not just trying to toot my horn or anything like that, and it's not that I'm some great agent. I've had a lot of great experiences, is basically what it is. So today I'm going to be talking about our One Pill Can Kill program. I know a lot of you guys are doing a lot of great work out there in Indiana, trying to help our community, especially even our young people. And that's something that I'm very passionate about and find very important and intensive to do. And that's, part of what I do in terms of DEA. We are a law enforcement organization. So we're not necessarily in the realms of educating and things like that, but we do have a small sliver of that, and that's where I fit in now. So I'm going to get into our presentation, and afterwards, I'm an open book. We have any questions that you may have, please ask. I really like a lot of dialogue with the people I'm talking with, because I think it just we'll gain a lot more information that way, I think, if we have a real good dialogue. So what I'm going to do, I'm going to share my screen here, and we'll get into my PowerPoint. Okay, can you all see that? All right. Can anyone see that? I can't hear anything.
It's up and ready to go.
Okay, thank you.
Good.
It's
Thank you.
hard because when you're screen sharing, it's like there's a lot of things I can't see. And of course, stand by. I'm sorry. Let me see. I need to move this around a little bit here. There we go. I think that'll be a little bit easier, because once you screen share like that, it's difficult to see where your mouse is. So again, I apologize. We'll get right into this. So again, we have our One Pill Can Kill program, and I'll talk a bit about that and educate you guys on that and what else that we do, specifically how we can help each other out with what's going on in the country right now and throughout the world. Part of what I also do is an I Choose My Future program. And basically what we're doing with this is it's essentially the same program that I'm providing for our young people when I'm talking at schools, but we call it I Choose My Future because it's really with the theme of the choices you make as a young person can really reflect on you later on in life. So we want to make good, healthy choices. So hence the name I Choose My Future. So again, a little bit about my background, you had already heard. So part of when I came to the Chicago Field Division back about almost 9 years ago. So I did about 10 years, almost 10 years in New York, and then came out to Chicago. Currently, I am the division training coordinator. So I handle training for our Chicago Field Division, which includes Illinois, Indiana, and Wisconsin. And I'm also the demand reduction coordinator. So demand reduction, meaning we're trying to reduce the demand for drugs. That's that small sliver I was talking about with respect to education. So these are just some photos of, some of the things that I've done. On the upper left, it's firearms training in New York. Currently, or I'm one of the lead firearms instructors for the Chicago Field Division. That was some training that we were doing in New York. On the lower left, you'll see me in our SRT uniform. SRT is our special response team. It's similar to a SWAT type team. And that was a hit, actually, we were doing in Gary, Indiana, on a drug house. So I was a part of that special team where we were targeting some of the most violent and dangerous criminals. Up on the upper right is me doing a community outreach at one of the schools, as well as the lower upper right and lower right, both community outreach. So I was a part of the Violent Crime Task Force in Chicago when I got here. So we were targeting the most violent offenders. I've been a part of our SRT, and now I'm doing community outreach and firearms training and things like that. So it's been a great career. I've had a great time doing it. My demand reduction efforts, we work with, other drug prevention coalitions, community schools, things like that. I've spoken to over 24,000 kids in the last 5 to 6 years in the school systems all around the Chicago Field Division. Now, I haven't really gotten into Indiana, so help me there, guys. Let me get out to some of the schools and speak. I would absolutely love that. The program that I have to provide for kids in the schools, again, we talk about all the different types of drugs that are out there, but I kind of have a unique perspective on it. What's kind of unique about my background is prior to coming into the DEA, I was actually the lead vocalist in a heavy metal band. So I had really long hair, bushy beard, and a lot of people would see that person and think, well, you do drugs. And I never did, not once. And I just turned 50 last year, and I don't even drink alcohol. But I was in a subculture of drugs and alcohol, and I've had a lot of friends struggle with addiction, die of overdoses, even go to prison for murder. So those experiences led me to become an agent with the DEA, and why I find it so important to help figure out how we can stop this problem of drugs and substance abuse disorder and things like that that are going on in this country. And sharing those stories, especially with young people, really seem to connect. And I think it can really help make a difference. And one last unique thing that had happened in my life that speaks to people, even young people. 7 years ago, my wife was shot and killed in front of me and my children while we were driving home from a vacation. And that person is a paranoid schizophrenic who was high on synthetic marijuana at the time, and we were the second victims. So again, I have a unique perspective on things, and I share that with my audience, even especially young people, because a lot of that opens a lot of doors for young people to talk to me, and then I can talk, get them encountering their counselors and help, and understand that trauma is difficult. Substance abuse disorder is difficult, but we need to help each other. We need to reach out to each other. And that's something that's very, very important. So again, enough of my spiel on all of that. I would love to be able to come out and to your communities, to your schools, and share in our presentation and help educate people. So one of the things we talk about is, why do people use drugs in the first place, right? What's the deal? Well, a lot of people are thinking, hey, it might be peer pressure, or maybe it's going to avoid their problems, or they think it's going to build their confidence. Maybe it's just curiosity, or it's self-medicating. And again, when I'm speaking with people, I can talk to a lot of these things, like peer pressure, for example. I mean, I was in a subculture of this stuff. I never did it. So you can fight that peer pressure. You can get through it, but you need to surround yourself around good people and make good choices. And, surround yourself around people who want to lift you up and not pull you down. But these are some of the things that we think about on, why people use drugs. And what it can lead to is that addiction. And again, especially for our young people, right? Scientists say that your bodies and your brains aren't fully developed until you're almost into your mid-20s, right? So taking some of these substances, even if they're calling it medicine, it doesn't necessarily mean it's going to be okay. It could lead to addiction. And especially for young people, because their bodies and brains are still developing, they're more susceptible to that addiction, right? And it's something that your body becomes greatly dependent on or controlled by. And then you have that dependence. And there's a physical dependence, which is a growing tolerance to a drug's effect, which require an increasing amount to achieve the same effects, and a psychological, which is a mistaken belief that drugs are needed to achieve a well-being. Who abuses drugs? Anyone. We can't get that stereotypical mindset of, oh, someone who's a drug addict is someone out on the streets and, might be homeless or look a certain way or dress a certain way. Anyone can fall prey to substance abuse disorder, right? Teens, college students, workers, professionals, stay-at-home moms, seniors, musicians, athletes, anywhere, urban, suburban, and rural settings. It doesn't matter your race. It doesn't matter your ethnicity, your socioeconomic status, your religion. None of that matters. Anyone can fall prey to drugs and substance abuse disorder. And the problem is if you even try to experiment with it nowadays, it could possibly kill you, if not leading you definitely down the road to substance abuse disorder.
This is your brain. This is heroin. This is what happens to your brain. You're snorting heroin. And this, what your body goes through. It's not over yet. This is what your family goes through. And your friends and Sure. Any questions?
Some of you may remember, maybe closer to my age and remember the old "This is your brain on drugs" video. And they they said that that actually didn't have as much of an effect as you would think. However, this new version, I really think is very important. And we're finding it to be more effective. And the reason that is we're talking about, this is what your body goes through. This is what your brain goes through. This is what your family goes through. Your friends, your job, your money, your self-respect, your future. Those things coupled in there, I think really hit home. And I truly believe that is a good video that can apply not only to heroin, but a lot of drugs. Vaping is a big thing that a lot of people are asking me to talk about, and I'm sure some of you are well aware of vaping. Vaping was originally created for tobacco users to get off of using tobacco. The thing is, now we're seeing a lot of young people use it. Why are the young people using it? Well, it was really pushed to a lot of young people through social media platforms. You were seeing videos on TikTok, Instagram, Snapchat, and things like that of young people vaping, blowing smoke rings. Oh, this looks really cool. Trying to get young people to get hooked. I mean, that's exactly what was going on. You could see some of the trends among, marijuana use, which is now in vapes, right? What we're seeing is not only people legitimately smoking, a marijuana cigarette or a bowl or a bong or whatever you want to call it. Now they're putting THC, and THC is the chemical that gets you high out of marijuana, and putting it into vape cartridges. So now we're seeing more and more young people getting addicted to cannabis and marijuana use, right? And, here are some, I'm sure some of you may be familiar with the SAMHSA organization, the Substance Abuse and Mental Health Services Administration. These are some recent stats that came out of one of their pieces of research that just came out a few months ago, just to kind of give you an idea of what's going on, what we're seeing in terms of trends, right? The different types of e-cigarettes that are out there. And the thing is, people can hide these things very easily, right? Flavored vapes. A lot of these flavors are pushed to young people. We've heard of flavors like Fruity Pebbles. That's not for an adult. Come on. And this is what we're seeing, right? We've seen people die and be hospitalized due to vaping. All right. Now, there is anecdotal evidence. Again, we haven't heard or proven it, but that that some people have seen fentanyl laced in some of these liquid fentanyl laced in some of these vape cartridges. And now, again, that's anecdotal, but I tell you what, it wouldn't surprise me. You can see some of the other trends from this study. Alcohol use obviously is always really at a high level. And why is that? Well, because it's legal, right? And a lot of people use alcohol. A lot of people use alcohol responsibly. Those are adults. Cigarette use has declined quite a bit over the years, but we are starting to see a small increase because people that are vaping are sometimes turning to cigarettes. And look at the marijuana use, much more than cigarettes, right? We were, this country was pushing about the dangers of cigarette use, tobacco use, and how it's related to cancer. So that really helped. But now, because we've legalized and commercialized marijuana, we're seeing a tremendous increase in that, and people saying that it's medicine. Okay. Now, are there medicinal purposes for the plant? Say, for example, Marinol? Sure, absolutely there are. But just smoking weed is really not a medicinal thing. And it's very addictive. And the THC levels we've seen in some of the cartridges have been over 95%. When I was growing up, THC levels might have been 8 or 10%, maybe at most, in marijuana. Now we're seeing leaf marijuana as well as, vape cartridges. We're talking over 90-95% THC. And for a young person specifically, that's tremendously addictive and damaging their brain. The drug overdose and poisoning crisis is a clear public safety, public health, and a national security threat. I'm sure many of you have been seeing, as well as, you guys have asked to come out and talk about the one pill can kill. And now I'm going to get into that, right? We're seeing all these newspaper articles or things on the internet. I have families contacting me almost, a few times a month at least, saying my son, my daughter took a pill from a friend and they thought it was something else and they died because it was a fake pill. And we'll get into that too. So what is fentanyl, right? Fentanyl is a potent synthetic opioid drug. It's approved by the FDA to use as an analgesic or a pain relief and an anesthetic. And it's approximately 100 times more potent than morphine and 50 times more potent than heroin as an analgesic. What's the effect on the body? Fentanyl, similar to other commonly used opioids, analgesics like morphine and things like that, produces effects such as relaxation, euphoria, pain relief, sedation, confusion, drowsiness, dizziness, nausea, vomiting, urinary retention, pulmonary constriction, and respiratory depression, right? Sounds like a commercial you're hearing on television at night. You hear all the side effects of this stuff. What we were seeing is drug cartels started to realize that fentanyl, it has such an addictive quality. They were lacing fentanyl in other drugs, lacing it in coke, lacing it in heroin. So we would see small trace amounts that way. And then what happened was we're seeing now kilos of fentanyl, and they're manufacturing fake pills. And what I mean by that are pills to look just like a prescription, and it could have fentanyl in it, or maybe just a trace of it, or the whole thing could be fentanyl. And I apologize for this this graphic. It's not showing everything because I'm using a different computer, unfortunately. But the bottom line with this is we had over 107,000 deaths of drug overdoses in a 1-year period, right? And in that 1-year period, over 65, I think, % it was, of that were related to opioids and primarily fentanyl. The record quantities of fentanyl that the DEA seized in 2021 are enough to kill every single American. And we're getting more and more of this every single day. That's a potential dose of fentanyl on the head of a pencil. It's an extremely small amount. Some of the most common counterfeit pills that we're seeing: Oxycontin, Adderall, and Xanax, for example. Which is fake, which is real, guys? What do you think? Take a moment and take a look. Which one could be fake? Which one could be real? The authentic is on the top and the fake is on the bottom. Look how similar they are. How about this? Which is authentic and which is fake? The authentic is on the top and the fake is on the bottom. So think about it. When people are getting, experimenting, and they may think, we've heard a lot of, I've heard from a lot of parents and teachers and research as well, about kids going to these parties where they're going to pill parties, where young people are stealing from their parents or grandparents. I mean, even in some circumstances, drug addicts might go to an open house, for example. Oh, excuse me, I need to use the restroom. They go into the restroom, or a person's personal bathroom in their home, and try to steal drugs because they might be in the medicine cabinet, or some people are stealing it from their family members from the medicine cabinets. Here's a medical grade fentanyl laboratory, right? Because again, we know there are purposes for this drug, legitimate purposes. That's why it's a controlled substance, right? That's a medical grade place. That's where it's being manufactured right before it crosses over the border and gets on our streets. That's an illicit fentanyl laboratory in Mexico. A lot different. And I mean, think about all the different contaminants that might be added into these different drugs. Even when I was in one of my enforcement groups several years ago, We had a case where one of the local drug organizations was actually lacing their drugs with rat poison. That shelf contains approximately 1.2 million fentanyl pills. This is a small amount. A small amount and we're seizing it all the time. I mean, one of the other jobs that I have in DEA here in Chicago is as an evidence custodian. I help with the drug evidence. And so I see seizures like this all the time. Percentage of tablets containing 2 milligrams or more of fentanyl from 2017 to 2020. Look how much it's increased, right? There's the average amount too. What we're seeing now out of our lab testing from the drug seizures that we have, 6 out of every 10 pills that we're seizing are containing a lethal dose of fentanyl. It's frightening. It's absolutely frightening. And one of the things we try to push and talk about, and one thing I do to kids, look, now sometimes you might need to take a medication, right? You might have a chemical imbalance, you might have an injury or something like that. And that's okay, as long as it's prescribed by a doctor and it's coming from a pharmacy. You shouldn't be taking anything that's not prescribed to you, number one. And you definitely shouldn't be taking something from, a friend that's, oh, I'm not sleeping too well. Here, take this pill. Unfortunately, that happened to a family member that, or a family, excuse me, that I met in the last year who lost their son to a fentanyl poisoning. He didn't realize it was fentanyl, and he took one pill and he died. Hence the One Pill Can Kill campaign. In 2022, DEA seized more than 50 million fake pills laced with fentanyl. This is a serious, serious issue, guys. And we need to educate our people about this. And thank God we're hearing more of it on the news. I'm seeing a greater increase. I know our administrator, Ann Milgram, was just on a town hall on CNN just a few weeks ago. The family that I was just referring to earlier, they've been on Fox News several times over the last year talking about the fentanyl crisis. So you got 2 major news sources right there talking about it. And that's very good and very important. We need to get as much information out there as possible to help save lives. And these are easily accessible. People are buying them off of social media platforms. I mean, the drugs are now being Ubered to you, or dropped in a mailbox for people to pick up. I mean, it's insane. They are working through apps on their devices, on their phones, on their iPads or tablets, whatever the case may be, setting up fake profiles, fake accounts, and starting to communicate with these drug dealers and then having the stuff delivered right to them. This is also important to note. Drug dealers for years have always used codes, right? When I was up on wires, for example, when I mean wires, listening to other people's telephone conversations, you have to go through a search warrant. You have to, you got to go through the court system to do all that stuff. It's not like I can just say, hey, I want to target that person's phone number. You have to prove a lot to even get to that point. But when you get to that point, a lot of the drug dealers, they use different terms. So, they're not going to clearly state, hey, can you get me, 10,000 pills of fentanyl for tomorrow, please? They're using codes, right? And now with with the phones and everything, people are texting using WhatsApp or all these other things. So they're using emojis now. And as you can see right there, those are some of the common codes they're using for the different types of drugs. So this is a serious, serious issue, and it's very important to talk about, and we need your help. And I know you guys, what you're doing out there in Indiana is important work, and I'm honored to be able to sit with you and discuss this, because we're all on the same page. We all want to help our communities, right? That's the whole point. We want to help save lives. And let's see, it's not, darn it, I apologize. Are you guys still there? Because my computer's froze up.
Yes, we're still here.
Okay, I don't know what's going on. I am trying to scroll through. I mean, I cannot get out of this screen. Well, I have one more screen to share, and for whatever reason, it's not allowing me to do that. I can't
if
even
you can-
escape out of this.
Greg, see if you can quit sharing and then reopen the share.
Yeah, I'm trying, but the problem is my mouse disappears.
Oh,
Wait, I'm getting closer. Okay, are you guys still there?
yep.
Okay, here we go. I'm gonna try this again. Where'd you all disappear to? So you're just seeing me right now, correct?
That's correct.
Yes.
Okay. Now where? Oh, there you are. All these windows. And I apologize. We'll go back to this and try it one more time. It's just a couple more screens. Okay, right. So again, know the dangers, the accessibility online, like we talked about. One Pill Can Kill is the campaign. You could try and get that, scan that and see, but otherwise you can go to the DEA.gov website. There's a lot of information on there that you guys can get. Here's my contact information for everybody to see. I wanted to make sure you guys saw that. So my phone number, my email. So if there's anything I can ever do, you guys can do a screenshot of that and get that information. And that's it. I can open it up to any questions now.
There was a question in the comments. I'm trying to pull my chat out here.
Mm-hmm.
Someone mentioned something about full kit.
Full kit.
Daniel,
What's your question about full kit? My all my gear? Is that what you're referring to, Daniel? Yes, full kit. Yeah, I think he was referring to all my tactical gear for the operations when we're out on the street like that. So yes. Trank. We are hearing more and more about Trank, and what they're doing is they're mixing fentanyl with other types of drugs. So the Trank is just new to us now as well. So I don't have much information about that, so I'm sorry. But my understanding is the Trank is something, I believe it's the Trank that they're putting it in with some of the fentanyl, and that Narcan can't help with an overdose if they have that in their system. If I believe I may be correct on that. Again, this is some new information that we're getting now with these different types of drugs that are out there, but we're seeing all kinds of different stuff, and it's just frightening. I mean, we're trying to keep up with everything that's out there. Any other questions, guys?
Christy has her hand raised.
Oh, that it was reported in the Chicago area. Yeah, I got to get with our intel people on that and our chemists to find out. But yeah, we've been hearing about that. I haven't personally seen it through our seizures, but I'll have to find out more about that. So I'm sorry, there was another question.
I believe, Christy, I see your hand raised. If you want to go ahead and unmute yourself and ask the question.
Sure, yeah. So I kind of have two different roles. I am a deputy coroner, and I've been with our coroner's office for almost 9.5 years. So I've kind of seen that trend of when I initially started, you would see heroin, strictly coming back in our toxicology, and now it's either pure fentanyl or heroin, cocaine, and fentanyl that we're seeing. But it's interesting when you showed the pills, because part of the coroner's office's job is to remove all of the prescription medications from the scene.
Yep.
And the police, take the drugs, so
Mhm.
it's kind of scary because we count the pills and all of that in our office and document that. But just the thought of removing pills that could potentially be pure fentanyl and may, the person's toxicology may come back as fentanyl. There wasn't any fentanyl at the scene, but, the coroner's office, if we are the ones who are obtaining all the prescriptions, and if we're obtaining that could have helped, it's interesting to me to think about that, because I use the pill finder app, to try to
Yes.
identify what we're seeing or what I take off the scene if if it's not in a bottle, which typically people just pour all their pills in one bottle, or they have them all mixed. So that's something, we actually have a coroner's meeting tonight, and that's something that I'd like to bring to the table so that we can discuss what that looks like for our office. We don't have that testing machines like the departments do to see if the pills we removed are actually what we're thinking it is.
No, that's interesting. So help me with this. I actually did an internship with the county coroner's office when I was a young man, starting out in college. I went to a community college and then later went to Southern Illinois at Carbondale to get my bachelor's and master's. But I did an internship with the Winnebago County Coroner's Office, and it was the most fascinating internship I had ever had. So I can really appreciate what you do, because I did that for several months and was involved in, basically every type of death that could be out there. It was very fascinating. So again, I appreciate your work. The one thing I'd be curious about is, okay, so when you guys are looking for the cause and manner of death, if there is fentanyl, maybe there's a way that, okay, you got these prescription pills, but are any of them real or are any of them fake? I'm wondering, is there a testing, I don't know if you could just go to like the DEA lab and say, hey, can you test our stuff? I don't think we provide that, to be honest with you. And I doubt that they would, just because we are overwhelmed, like you wouldn't
Yeah.
believe. Like you know what I mean? Is there somewhere you can do that, or?
So
Yeah.
I'm wondering if that's something we could talk to departments about. I do know that that some departments carry like the field testing kits where
Oh, yeah.
all you need is like a little sample, and
Mhm.
that's something that our local coalition was able to purchase for the department's use.
Oh, very good.
So I'm wondering if that's something that maybe the coroner's office can get in on, because typically we just amass a collection of
Right.
prescription pills, and then whenever they do the DEA take back or whatever, we
Yeah.
you
Mhm.
know we do
Have them
that.
destroyed properly.
Yeah, so that's what we do at our department. But I mean, that really has me thinking a lot about how we maybe need to change our collection methods or the things that we're doing on that end.
Yeah. Oh, I see a question, and I appreciate. Well, here, I'm sorry, Jay. Do you want me to just?
That's okay. Yeah, there was a couple of questions that are in the chat, and one of them you guys kind of just addressed on. One said, could fentanyl testing strips be used? And then the other one is most of the fentanyl coming from Mexico, and
Yeah.
how can we get ahead of that epidemic?
Yeah. Okay. So first of all, I'll address the testing strips to Jesse. And here's the thing. And Administrator Milgram had said it at that town hall on CNN. So I'm basically taking the words out of her mouth. But fentanyl test strips, like, it was frustrating because we had Lollapalooza in Chicago, last year, right? And there were organizations handing out fentanyl test strips, like, oh, here, make sure everything's going to be okay, so you could use your drugs safely, which I understand. I mean, people that are addicts and suffer from substance abuse disorder need help. There's no question about that. But we're also kind of in the thought process, we don't want people to encourage drug use either. So, I mean, there's that balance that we have to find. Fentanyl test strips, and again, this is coming from Administrator Milgram, they're not going to work on a pill, because a pill can have a whole bunch of different drugs in it. So just touching it in one spot, you're not going to be able to find out. Excuse me. The only way you could tell from if there's fentanyl in a pill using a test strip is if you crush the whole thing.
Mhm.
So, excuse me again, it's not going to work in that way on the pills. So that's really a misnomer and misguided information on that. Now, is most of the fentanyl coming from Mexico? Yes, 1,000%. Okay, it is. The precursor chemicals are coming from China and India. They're going to the cartels. The cartels are manufacturing it and then pushing it over the border. It's just the way it is. And it's sad because Mexico is a wonderful country with wonderful people and a great culture. And these cartels are ruining it for a lot of people that live down there. And it's very, very sad. But yeah.
So with that being said, what is something that we can do as frontline staff that works with youth in people today in our communities? How could we help in a situation like this? If we discover something, if we hear about something, what would you suggest to us as frontline staff?
I think the biggest thing is we just have to be real with our young people. Just look, this is the reality. This is what's going on. People are dying. People are falling prey to substance abuse disorder. And these drug dealers don't care. They don't care about anything. They want to get people addicted. And they don't care if you die, there'll be another person. So I think the biggest thing is just being real with them and not hiding it. It's sad because, I try to get into all these schools to talk, and some schools are like, oh, we don't have a problem. We don't want to, we don't want to address that. And it's like, it ain't about having a problem. It's all about education.
Right.
And not for nothing, these kids are seeing it. Even if you may think, well, I gotta, my kids are in a good school, there's not that much going on. If they're not seeing it personally, I guarantee you they're seeing it in their social media. So we just need to be very real and let them know the dangers of this stuff and how much we care, and we want them to live and make good, healthy choices. So I think the biggest thing is just being real with them on the dangers of this stuff. And specifically, don't take a pill unless it's prescribed to you by a doctor from a pharmacy, and you're going with your parents or your caregivers. Okay. Because someone can say, well, I got a prescription drug here. I'll just give it to you because you don't feel so good. You shouldn't be taking that either. I don't care if it's, oh yeah, I take the same medication, but I'm out. No, don't. It's not worth the risk. Lives are being lost. I told you, it's so sad to me. I've had so many families reach out and that are going through this, and then they start their own 501c3 because they're trying to educate other people and do the same thing in the memory of their son or their daughter. I mean, we had a family summit in Washington, D.C. last year. So Administrator Milgram had requested all the field divisions to look for families that had suffered from the opioids and fentanyl poisonings and overdoses. And we were going to bring families from each of the divisions to represent those areas to come to DC. We had members of the CDC there, all our hierarchy. I think one of the deputy attorney generals was there. I mean, it was a big thing to sit down and talk and say, hey, what's going on? We want to hear from you as a family. Why? Why are you? Excuse me, not why, but what is going on, and how can we help? I mean, that's what we're looking for, and it was very successful. And one of the things that the families kept saying that was very important that I took home with me is people always saying overdose, overdose, overdose. Now, are there people that overdose? Absolutely, but we got to get out of the mentality of when you think of an overdose. In general, I think people think of a junkie, or someone that's, oh yeah, that's a drug addict. But there are people that have been poisoned, flat out poisoned. They don't know what drug is in there, and it winds up being fentanyl. That's a poisoning. It's not an overdose, it's a poisoning. And we're trying to change that and let them know. So that's one big thing. The importance of that family summit was so great that Administrator Milgram had requested each division to do one locally. And we did one. I had organized with a team of people, organized a family summit in Chicago right before Thanksgiving. And we brought some of those other families and some of those families I had in DC, as well as some other families that reached out, as well as drug prevention coalitions and people from the health community and things like that, to just let's network. What can we do to help each other? So yeah, I
Excellent.
think the biggest thing, I'm sorry, that was like a long-winded answer, but I think it's just being real with our people.
Excellent. No, we appreciate that passion, and that's inspires us to want to do our part and what we can to ensure that we're bringing awareness. So some people have asked if you could share your information again. So I don't know if you could share your screen and just
Yeah,
put
I'll do
that
that.
one section back up. That would be great.
Yeah.
And then with that too, I know that you mentioned your website and some other things there. But where are some other resources that we might be able to tap into when it comes to sharing this message that you're presenting us today? Is there brochures? Is there resources to the website? Is that video that you showed at the very beginning, which is very interesting with the egg in the pan, is that available to utilize?
I believe it might be on the DEA website. Oh, when I share my screen, is my meeting chat showing or no?
No, all we see right now is just your slideshow presentation. So
Okay, but when I
what-
show, again, I apologize. So
you're fine. Yeah, that's perfect. Right there, what you have.
okay,
This is what people are asking for: your contact name,
Yep.
your number, as well as your email. So if
but
everybody would
so-
like to take that opportunity to screenshot that, take a picture, whatever you need to do, but that's his contact information there.
But with respect to what you were just asking, we have different materials that you can look on the website, but if not, just reach out to me, shoot me an email, and I'll send you guys some things. I mean, we have brochures on teens and marijuana use, the different types of drugs that are out there, drug use among college kids. I have all kinds of things that I could send you guys.
Perfect.
So if you just send me a request via the email, I'd be more than happy to work with you and be able to do that.
Excellent, excellent. Well, I know that we kind of deviated away from our normal format, which is perfectly fine. A lot of great questions, a lot of great presentations today, things that we were shared. Is there any other questions that anyone on the floor would like to ask?
I guess my big question is like, so I do like substance use education groups at our alternative school, but I feel like I get more pushback. My employment agency has changed. So even where I work now, people wanting to kind of like, well, let's not talk about substance use right now. And even like in our main high school, trying to, I guess, build those relationships to allow us to get in, like any suggestions or what has been most effective in your experience trying to get into schools to do these educational curriculums?
Well, I know for me, what I've done personally, and I kind of have a, we're sitting in, we're aligned with what we're both trying to do, but sometimes the schools get a little intimidated. It's law enforcement people, and there's been a trend of, anti-law enforcement stuff going around for the last several years due to some really unfortunate circumstances that some law enforcement have been involved in, but we can't paint a picture of everybody being the same in that way. What I've done is every time I'm done doing a talk at a school, I have the principal or whoever reached out to me to have the talk to write me an email, or my boss, the special agent in charge of Chicago, like, hey, we liked Greg's presentation, or it was no good, or whatever the case may be. And I'm like building a resume essentially. So if a school says, well, yeah, I'm not sure. Well, here's a letter I got from this school. Here's an email I got from this school. And this is why this program is good. It's getting people to talk. It's helping to change lives. So, I mean, I think the biggest thing is just from the standpoint of, it's not about, oh, do this school have a problem? It's going on everywhere. All we're trying to do is educate, right? Everybody's in the business of education. And that's what's important. So.
Any other questions? All right. Well, this recording will be available and it will be on our website. So again, that will be sent out as well, along with the survey, just thanking you for being here today, and I'm looking for future presentations. So without any other questions, I think we're going to go ahead and end early today. Thank you to our special guest, Special Agent Greg. Thank you so much for sharing the information and engaging with us through some Q&A today. A lot of great comments in the chat there, very informative. Thank you for sharing. Great information. So just a lot of great feedback. So thank you so much for taking your time today to share this information with us so that we can become better advocates in our communities and to help the students and the folks that we serve. So this, again, like I said, this presentation will be recorded and it will be available onto our website. So if there's no other questions, I would just like to say again, thank you for being here today. Thank you to everyone else, and we look forward to seeing you all next month.
Yeah, well, thank you for having me, and continue the work that you guys are doing. And if there's anything I can do, like I said, you have my contact information, shoot me an email. I'm be more than happy to send you some of our pamphlets, brochures, things like that deal with these topics that I think they're good to have in the schools or for parents to be able to read and take a look at. No problem with that. So and more than anything, I'd love to come out to your community and school, be there personally, and be able to provide what I'm doing here.
Excellent. Thank you so much. We appreciate all your hard work and sacrifice that you do every day to make our community safe and bring in awareness. We
I
appreciate it.
appreciate that.
All right. Well, without any further ado, thank you all. Have a great rest of your day, and we will chat soon.
Take care, guys. Thank you very much.
Thank you.